Welcome back to another video. In today's video, we're going to talk about the opioid crisis, and I'm going to share with you a few experiences I had in the emergency department and what I think needs to be done for this issue to be solved. If you want to gain more information about nursing or to improve your nursing knowledge in general, please consider subscribing down below. I upload a video every single week and you don't want to miss them. I also have free resources that I created down in the links below. But without further ado, let's get on with today's video, which is talking about the opioid crisis. Now that I've finally moved my cat out of the way, I want to get on to today's topic, which is the opioid crisis. And I want to raise awareness about this issue because although we're in a huge pandemic, I feel as if the opioid crisis is just as big of an issue, yet it doesn't get the awareness it deserves to really have strong interventions to mitigate the effects of this. And another reason was that I experienced these patients in the emergency department all the time, and it's becoming a more and more prevalent theme. And I feel like the reason is because there's a huge knowledge deficit within the public about what actually needs to be done in order for this issue to be solved.
The time when leaders are searching for solutions. Between January 2016 and December 2019, more than 15,000 people died of apparent opioid overdoses, and the crisis is escalating. This past May, British Columbia reported 174 suspected opioid overdose deaths, a record high. That record was broken a month later with 177 deaths. In July, another 175 people died. Tyndall says current opioid drug strategies are failing and more must be done to provide users with a safe supply.
If we're watching people buying poison and just standing around with naloxone kits trying to revive them, I mean, how many years do you want to do that?
So I always like to use the analogy of think of a person breaking their arm. You know, you can prescribe medications to relieve the pain, such as, the hydromorphone, morphine, or acetaminophen, whatever the case may be. But what truly is going to fix them is going to the operating room and having surgery, or having a physician do a reduction and putting them in a cast or whatever to fix their situation. Those drugs that you give them are for symptom management. It's not going to treat the underlying cause. In relation to the opioid crisis, we're providing naloxone kits and training to save lives when they overdose, which is helpful, and not to say that they're not helpful, but they're not treating the underlying cause. We're just treating basically a symptom. To treat the cause, we need to really identify why there's such a huge demand for opiates. And we can't find huge amounts of data on this until we create a relationship between healthcare and the patient. However, there are steps being taken currently that are trying to create a better environment between a substance use user and healthcare. And we need more of that. A great example of this is Insight, which is a service. It's basically a clinic where people who are substance users can come and get free syringes and free sanitary means of injecting themselves. Now, this is the type of thing where it's going to create more communication between a user and healthcare. And that's ultimately what we need in order to understand why there's such a huge demand for people using opioids. It's so important for you as a person, as a healthcare provider, as a healthcare professional, to create a good relationship between a person that's using substances in order for you to truly treat the reason for them using. And until we are able to establish that relationship, there's not going to be a real good solution to this. Another very excellent intervention that has been implemented in British Columbia is the fact that now nurses can prescribe narcotics, and that will ultimately increase the relationship between healthcare and the patient for someone who uses substances. Unfortunately, somebody who wants to use substances has it's so accessible to them that they can go to the streets and unfortunately obtain these drugs through illegal means. And so as a result, these drugs can be laced with fentanyl and ultimately lead them to overdose and die. But if we create an environment where, healthcare professionals such as nurses, or we have a lot of insight clinics, can prescribe these medications to patients, that will create that relationship like I talked about, and ultimately we can understand why there's such a huge demand for them to use. So now that I've been working for approximately 2 years, I've really realized and come to the conclusion that there's this never-ending cycle within these substance use patients. And it's really unfortunate for them to be stuck in this, and I feel sometimes hopeless as a person giving care to them. Not that I'm, not providing good care to them, it's just I always question whether we're actually treating the underlying cause. So the cycle usually occurs like this, where people buy these drugs from these shady sources, like I talked about, from the streets, and these drugs are often laced with fentanyl, and because apparently fentanyl is so cheap to make, this makes the drug that they take so much more dangerous, as it can lead to overdoses. So if they overdose, they generally are with a partner, or if they're not, then that's even more concerning. But generally, if they're with a partner, or if they have family members and they overdose, this person then, the family member calls the hospital, and then they get admitted into the hospital. This ultimately costs taxpayers money, and this causes, a whole bunch of issues, which ultimately leads to us as working class citizens paying more taxes. The money that goes into these drug dealers that sell shady sources funds criminal activity as well. So, what I'm really getting at here is, if you think about why these drugs have not been legalized yet in a controlled way, it's very confusing to me, because these shady sources are not only creating drugs that are even more harmful, but they're also funding different criminal groups, which leads to higher incidents of violence and criminal activity, which are ultimately bad. So the solution that I propose that we should make as collectively in North America is to legalize all these drugs. This is beneficial in many ways. Like I mentioned, the hospitals are less overburdened with these patients. The patients themselves obviously get access to clean sources of the drugs. They're not laced, they're not more at risk of overdosing, and ultimately that relationship with healthcare gets established, and we can create more data that is needed to provide evidence-based interventions for these people. If we aren't able to get that data about why people are using so many opioids and really find information about these people, we can't fund certain areas of healthcare that these patients desperately need in order for them to not use substances, or to provide them with effective counseling services or effective care in order for them to decrease their use of these drugs. And if you really think about it, we drink coffee, tea, and even aromatherapy is a type of drug. And of course, this is not as extreme as opioids, but nonetheless, it is a drug that we, either ingest or inhale regularly every day. Imagine going about your day without coffee. I mean, I personally drink a lot of coffee throughout my day. And how terrible do you feel if one day you all of a sudden didn't drink coffee, and you realize how much you need that caffeine in order for you to function good? This is what an opioid addict states, but in a much higher magnitude. And obviously the effects of these opioids and these drugs are much more harmful on the body than what we use. But what I'm trying to say is, we all can relate to using some sort of drug to better our health. And that reason for us using it might be that we need a little bit more energy and we need a little extra boost in our day. Well, if someone's using these hard drugs, they're going out of their way to achieve a certain therapeutic feeling that we don't understand. And we need that communication, like I mentioned with healthcare, to have a good understanding of that. Obviously, you can't compare coffee and caffeine to opioids, but essentially, what I'm saying is that we all use some sort of drugs, whether it's caffeine, acetaminophen for a headache. We use it to treat our symptoms. The drug addicted person is using drugs for most of the time an underlying symptom, whether it is trauma from a past experience, or anything else. So they will use it regardless to treat their symptoms, but do they have access to it? Yes, they have access to it right now through shady sources, and we need to fix that issue in order for us to fix the overdose crisis. So that's going to be the end of this video. There's obviously a lot more you can talk about the opioid crisis and the overdose crisis, but I want to keep it relatively simple and short. If you have any comments or questions, let me know in the comment section below. There's so much you can, like I mentioned, there's so much you can talk about different issues and different ways we can mitigate this problem. But in my opinion, there's a huge knowledge deficit between the public and what the experts have to say about this. And through my experience, I truly believe that in order for us to have a good understanding and control of this issue, there needs to be legalization of drugs on all levels. It doesn't make sense the way it is right now, and as a person who deals with these patients all the time, it becomes so frustrating for me to provide care in a way that makes me feel good about it. I'm not treating their underlying cause. I'm not treating their underlying issue. I'm just helping them manage their symptoms through, benzodiazepines or whatever the case may be. I'm not actually helping them treat the root of their cause, which is ultimately doesn't make me feel good at the end of the day. Anyways, guys, if you like this video, give this video a thumbs up and we'll catch you in the next video. Thanks for watching.